All right, so we are continually watching the Groves case where both parents are charged with the murder, abduction, and kidnapping of their just 5-month-old baby that they received from Child Services. But I want to take a moment for a second to speak with our guest, Harry Nelson. And I want to make sure I get this right. Harry Nelson is the founder and managing partner of Nelson Hardiman, a healthcare firm. And you're also the author of The United States of Opioids, A Prescription for Liberation, A Nation in Pain. Harry, good afternoon, and thank you for joining us.
Thanks for having me. Great to be with you.
Now, Harry, as we cover this Groves case, it's kind of the elephant in the room. It's always there. It's kind of always hovering, the opioid crisis. Talk to us about even this mother, this baby who was born with methamphetamines in its system, and how that's not just an individual issue we see in this case, but also one that we see across the country.
Yeah, so I mean, this case obviously is horrifying, but I think what's important for us to remember is that there are thousands, tens of thousands, of children being born across America with what's called neonatal abstinence syndrome. That is, children whose mothers were addicted to an opioid, to prescription opioids, to heroin, or to fentanyl, and it has profound implications. And we also have thousands, tens of thousands, maybe more children growing up across America who don't have parents, who either don't have functional parents, and this is just, these are ways in which this crisis is really profound, and in which this case should be a wake-up call to a bigger story that should trouble all Americans.
I would agree. Now, throughout this case, we've seen some systematic failures from the Child Services, from checking with these parents who are now being prosecuted for the death of Dylan Groves. And we saw some ups and downs and some failures where we say, hey, where were the checks and balances? Where did this go? And so my question for you is, where do you see the balance between public health issue and parental rights, where we might have to say, hey, we as a community might need to step in to make sure that these babies are taken care of and we get far less Dylan Groves?
I think it's a very difficult question. I think there's two issues. One is, what is the responsibility of our public health agencies to step in earlier and intervene to protect children? And the other is, from a healthcare perspective, how do we reduce the shame and the fear that parents have, and make it so that more mothers are likelier to get help, to be aware and to get help without fear of losing their children. So I don't have answers here. I think that every public health, every community, local community, every state needs to be grappling with this. And we are seeing a handful of communities around the country that are making great inroads by making this a priority. I was just working on with a program in Arizona, statewide program that's very progressive in trying to just call attention to this and create more awareness so that more mothers get help and more kids are protected. And it's a complicated issue.
Yeah. Now, we definitely want to get rid of that stigma so that people can come forward and definitely find the services and help that they need. But Harry, I always ask this question. I'm talking to you as an expert. I get the opportunity to speak with you, and that's amazing. But what about for the everyday Joe who's like, hey, I don't talk to Harry Nelson. I don't know where to go. I'm listening to Harry Nelson, and I want to help. But what do I do? How can the average American help in this situation?
I think that, look, there are a lot of resources out there. We have a massive job to do of educating people at all levels. So look, there are great resources out there. The National Drug Helpline has a phone number that people can call. The federal government is actually, through the Substance Abuse and Mental Health Service Administration, is putting out all kinds of information. And I think it's just important to be educated about it. And I think there's a fear out there that people have that that the government is just going to take their kids away. And the reality is that we're at a point in American life when there's a recognition that this problem is affecting everybody across all zip codes, across all income levels, all ethnic groups, everybody. We're all in this, and obviously we want kids to be raised by their parents, but people need to get help. We're putting a lot of resources out there. It's just that people need to go out and find them. And I'd encourage people to start with just typing in National Drug Helpline as a starting point.
Now, let's say we overcome that hurdle of just connecting people to the services and trying to eliminate that stigma? What do you feel is the next step once they do get into those services? How are people, or how do you see people really healing both individually and as a family from the services that are available?
I mean, I think we need people. There are resources out there that are not being taken advantage of. So, for example, we're making a huge effort as a country to put more medication-assisted treatment out there and to create more counseling. We're in this problem sort of snuck up on America in the last 10 years, 15 years, but there are massive resources out there, and I would encourage people, for example, anyone who's listening who is personally or has a family member, a loved one, a connection who has an addiction, to look at the resources for medication-assisted treatment in the community, to pursue them, because this is not an easy problem to tackle for any person or at a global level, but it's just about small steps. And so, for example, getting people onto Suboxone who have a prescription opioid addiction, or people taking methadone, getting access to methadone who had a heroin addiction, those are positive steps forward. And we just need to spread information so that more people are getting access to more resources.
Yeah, and so we got education, connecting to resources, using those resources. We definitely want to continue with that. I wish I can grab my bag real quick in the corner, because I'm actually, and I will when we start to talk, I know that we also have programs here in New York where some district attorneys' offices are actually giving regular citizens prescriptions to carry methadone packets with them, because sometimes we have clients that are going through withdrawals. Sometimes we see people on the street in New York who are going through withdrawal. And so I'm starting to see a push for even just regular citizens and lawyers to have the ability to help and give these services to people. And so the question I have for you is, this came up maybe 10 years ago, kind of snuck up on us, as you said. Do you see us moving in the right direction? Do you see that the steps we are taking are not just having small incremental gains, but like serious incremental help for this community?
I do think we're making progress. I think, if you look around the world, America has been slow to adopt what's called a harm reduction approach that has been used more it's being used in Canada, it's being used in Europe. And that's an approach where you really try to destigmatize and just create resources for people, even if we're not going to stop people from being active drug users, just making sure that they're using clean needles, that they are using drugs in a place where they have access to resources for overdose prevention. There's a shift happening across America. You can see it loud and clear. New York has been a leader in this harm reduction movement. And I think I think we are making progress. We're not going to solve this problem in a day, but we can make things better. And I see a movement where more people are waking up and realizing that we just need to take baby steps, like you're describing. And by the way, I'm seeing a lot of change in prosecutors and in law enforcement, recognizing that we've got to stop. We've got to move from just putting people behind bars and start moving as people who can be helped into healthcare settings for treatment.
Yeah, and I'll do my little plug in here. I have the opportunity to just reach in my bag. I actually carry this with me all the time. It's an overdose rescue kit. And inside the kit, I have a little opioid safety pamphlet here. I have my gloves. I also have 2 inhalers for people if they are going through an opioid overdose. So to your point, Harry, I would say that we can all kind of do a little bit to help. Thankfully, I've never had to use this before, but it's a good thing to have on us. The other thing that I would tell our viewers that you definitely want to do in terms of being educated, read Harry's book. Okay, like I said at the beginning of the segment, he's got the United States of Opioids, a prescription for liberation, a nation in pain. Education is always the first step. You get educated, you know what you can do, and then you go out and do it. Harry, I want to leave you with some final words. What do you want to tell the viewers, not only about this case, about your book, about the opioid crisis, but what should we be left with after this interview?
So can I make one clarification? It's fantastic that you're carrying that kit. That kit is naloxone, the overdose reversal drug, which is different than methadone, which is a drug that you get in the clinic for treatment. But I think that's just an example of my final message to people, which is this is a super confusing topic that's evolving, right? The crisis is changing. We're seeing new drugs, problems of drugs being cut. And so it's critical to educate yourself. My website, harrynelson.com, is a place where I put up resources from the book for free. And I would just encourage people to not just think of this as an issue that you study one time. This is a topic that we've got to be following week by week, month by month, and just getting our hands around a little bit at a time.
Harry, I want to thank you for educating me about my own package. Thank you for that. Educating our viewers and for taking the time to educate us all here at the network about this crisis.
Thanks so much. Thanks for having me on.
Thank you. Now, we're going to take a quick break. As I did say, we do see some movement in the Groves case, and we may be back with live coverage after this break.